live.
I'm checking my connection.
Hi everyone, we're back with our live lunch and learn, tea time, tea Tareen time, whatever you want to call it. Today's focus is scarring. Sorry we're a little bit late. I was actually helping fix somebody's acne scarring in the other room with a procedure called filler. We'll take off our masks now, but you can know we're all being very precautionary in the office, right, Kelsey?
Yep.
So excuse us if we have like dried spit on our mouth. So Kelsey, you want to go over our agenda for today's tea time?
Yeah, for our agenda today, we're mostly going to talk about acne scarring first, and then we're going to talk about two particular types of scars that people can get. One is called a dermatofibroma, and the other is called a keloid. And then we'll kind of talk about a couple of procedures that we have for things that traditionally you think of as scars. One is our superficial radiation treatment that can help prevent scars from skin cancers. And then we'll talk about the minimal type of scarring that you can get from a procedure called Mohs.
So let's start with acne scarring, because that's one of the things that Kelsey and I get all the time. Unfortunately, sometimes people's acne is really deep and it leads to scars. Unfortunately, sometimes you don't even have deep acne and it can lead to different types of scars. So scars are categorized into kind of superficial discoloration versus somewhat deeper dermal scars. And there's really a few types of scars there. There's one called boxcar, which is more kind of this square indentation. There's one called roller, which I think is the most common, where you see those people who just have not smooth skin, their skin kind of ups and downs like that. And then there is a third type of scar called ice pick, which literally looks like little picks in the skin. It's important to classify the type of scar that the individual has because they're all treated a little bit differently. What mostly do you see with scarring, Kelsey?
Well, one thing it's really common, and a lot of it does fade with time, which is, I think, important to reassure, especially young kids. Moms are always panicking about this potential scarring, and a lot of it does fade by the time the kid gets a little bit older. I mostly see some of that rolling scar, and for a lot of people it's very concentrated on, temples is a big one.
Right.
And they may have it everywhere, they may have it just in certain areas. Which we see a lot. And no matter where the scarring ends up, there's lots of different treatment options for it, which is really nice.
Right. Let's start with most superficial scarring. Like often in darker skinned people like me, we'll see brown purple scars, and more fair skinned people like Kelsey will see kind of like pinkish scars. What do you like for that kind of discoloration scarring, Kelsey?
I tell patients to keep it simple. If you're getting that type of scarring, you are still actively breaking out with pimples. And a lot of the acne treatments that we use will treat both the discoloration and the acne itself. So that's the most important thing, is to get the acne under control.
Right.
Otherwise, we're just chasing our tail and trying to get rid of the dark marks without fixing the cause of the dark marks. I see a lot of patients get a lot better on, the various acne treatments we tailor to your particular condition. So if you are a person with darker skin colors, I use particular medications that work better with dark marks. And then for somebody like me that has more of a pink tone, we have some anti-redness medications that work for the acne and the redness. So.
And sunscreen is key too, because the skin is inflamed with that active acne. It's important, your pigment cells, your melanocytes are either making more pink or more brown, so it's important that you wear sunscreen while you're going through these endeavors. One thing that we love for those superficial kind of lightly discolored scars are a topical class of medicines called retinoids. Retinoids are topical vitamin A derivatives, and they exert their effect by lightly peeling the top layer of the skin, also stimulating collagen production. So you help both superficial and slightly deeper scarring. What do you think? People often say to us, "Oh, it's summer, I can't use my retinol." What do you say to that, Kelsey?
Retinols do increase your sun sensitivity, but the key is to use them at night, wash your face in the morning, and as long as you're wearing sunscreen during the day, it really doesn't, oversensitize you to the sun where you won't be able to go out.
Right.
It's much more important to stay consistent with your retinoid regimen than it is to go on and off of it all of the time.
Totally. Flip the camera so you guys can see my sweet girls who are recording. Guys, film each other.
Hi.
So girls, we both have very different skin tones. Do you use your retinol in the summer?
Yes, I'm trying to talk to both. No, so I only use my retinol though twice a week. I have very sensitive pink skin, so I only use it twice a week, not very often. just because I'm a little more sensitive, I get more photosensitive. But you definitely still can.
And I'm on the same boat. I have really sensitive skin as well. I use it once a week, and that's good enough for me. And it really does help treat. I'm a person of color, so I get some of that hyperpigmentation as well, and it is a godsend. So.
We all love our retinoids.
Yes.
So both Kelsey and I advocate to our acne-prone patients and also to our patients who, want some anti-aging. You can use your retinoid, but just like Nicole said, you tailor it to your own skin. Just like Christine said, she can only tolerate it once a week, Nicole twice a week, Kelsey a few times a week, and good old Dr. Tareen every night. What other really nice treatment that gets overlooked in these days of expensive lasers and fillers are something called chemical peels. That's one of Kelsey and my favorite treatment for acne scarring because they're inexpensive and they help both the discoloration and also the texture. What do you think of chemical peels for both active acne and scarring, Kelsey?
I love them. They really work well from a mental standpoint too, because they're one of the fastest things we have that give you nearly instant results. So that's really nice, especially if you're still actively breaking out. You don't want to spend a bunch of money on lasers if you're still getting new scars popping up. And so the chemical peels are really nice in between where they're going to help your acne and the discoloration and more slowly help with the texture changes, but they help instantly, which is super nice.
Right. And we try to keep them pretty affordable at our office. Chemical peels are $95 for one. So, it really can help a lot of people's price points. So that's a nice option for, everyone. Another option that often overlooked and also inexpensive are something called saline injections. That's where we actually take just normal saline, which is kind of salted body water, but it's made in the laboratory, and we inject it into the scars. What do you think of that treatment, Kelsey?
It actually works surprisingly well.
It sounds like voodoo.
Yeah, it does sound like voodoo. It does work really well though. You do have to do them serially, meaning you have to do them relatively frequently to get rid of the acne scars. But we use them a lot actually for surgical scars.
Yes.
Even once or twice can make a huge difference.
Absolutely.
I've never, thank God, had it happen to me, but I do have some PA colleagues who have seen atrophy from steroid injections that people get. And the saline actually helps a ton to fill in that indentation that people can get from that too. So it sounds hokey, but it actually does work really well.
Definitely. Should we move on to slightly more invasive treatments for acne scarring? People ask us all the time, if I had to treat my scars, what should I spend my money on? And it depends kind of how much downtime you want and how much effectiveness. So kind of if you want to start like the gold standard, the most aggressive treatment you can do for acne scarring is something called CO2 laser resurfacing. CO2 laser resurfacing has been around for about 25 years. In the past 10 years, we found ways to fractionize it so that it only causes little holes in the skin, but those holes can go really deeply and stimulate the collagen. Kelsey's had CO2 laser for her face. What do you think of it, Kelsey?
It's intense. I think that's the biggest thing to know, and I always tell my patients this. It is the gold standard. Right. It is more of a only have to do it once, maybe twice treatment. But you're going to get much more powerful results out of it, but you also, the more powerful results you get, generally the more downtime you have.
Right.
Anybody that does it, it gets pretty swollen for, I would say, at least a good week. You're pretty discolored. I'm super, super red for, a good week and a half. And you do get scabbiness pretty much everywhere. But it does work really well. It actually is something we use for anti-aging too, to help tighten the skin and, fix wrinkles and things like that. So especially somebody that's trying to get two things out of it, it works really well for that.
This is one of our colleagues.
This is one of our colleagues. And she has that type of acne that's really not that bad, but she just is a person who scars from it all the time. So this was Erin after one CO2 laser treatment that she had done, and she got some really nice results out of it.
You can see not only are her deeper scars better, you can see her redness is better, and her skin overall looks, just healthier because we've really resurfaced it. She has brand new skin there. And just so you know, it is downtime, but it also depends on the profession. Like now is the time to get CO2 laser resurfacing if this is your, a lot of people are at home, a lot of people are wearing masks. Kelsey worked through all your CO2, like she came and saw patients, so
Yeah, it's not downtime, like you can't do anything.
Yes, it
Like
doesn't hurt,
Yeah,
you know.
you definitely don't want to schedule your most important client meeting.
Prom.
Or your wedding. You definitely need to give yourself some time to recover.
Right. But that is kind of like the most aggressive if people are like, I just want my acne scars gone, I want 1 or 2 treatments. CO2 laser resurfacing is expensive. We charge $2,500 for the full face, about $1,500 like if you want to just do your cheeks. But it is only something you have to do once or twice in your lifetime. So, you want to go into microneedling, Kelsey?
Yep. This is one that we love around here. The microneedling is great because it works for all skin types, all ages, all different people. It is a similar concept to the CO2 in terms of, I always tell people it's like drilling little micro channels into your skin. Your body goes to repair those to help fix the scarring. It is just on a much less intense level than the CO2. It doesn't go as deep into the skin, so you don't have as much of the downtime. And so typically with this, we recommend a series of treatments to get the results that you are looking for. But we use topical numbing medication, so it really isn't painful. There's a few spots where you can get pinpoint bleeding, where you get tiny little scabs in certain areas. But it's really very tolerable, and you're usually read for a day, maybe 2 at the very most, and then you tend to look relatively normal. Women can cover it with makeup pretty quickly, which is really nice.
For someone like me, I'm red for like an hour, and then I can go out. So it all depends on your skin tone. Flip the camera on Nicole. When did you have your microneedling? 2 weeks ago?
I had it like a week and a half ago, yeah. And the thing I love about microneedling is that it does help with like any superficial pimples and things like that. But then for me also, it makes me feel like my skin is a lot tighter, brighter, and I have the most red skin, I think, out of anyone. But I'm only red for like, honestly, 24 hours. So it's my favorite thing here. I love it.
We all love microneedling. It can be done in dark skin, it can be done in light skin, it can be done in young people, it can be done in old people. And I think the price point is like around $300 to $400, so it's not $1,500. So that is something that kids benefit from, adults benefit from, seniors benefit from. Filler is another option. People think of filler as an anti-aging thing, to fill your cheeks, to fill your nasolabial folds, to fill your lips. But we do filler all the time for acne scars. It's a great treatment. What you say, Kelsey?
Yep. Yeah, there's different types of fillers out there, and there are some that lend themselves really well to fill in acne scars. They're not as stiff as some of the ones that we use for deep lines and wrinkles. So they really look really natural.
Right.
And again, the benefit of them is it's instantaneous.
Yes. Yes.
We literally fill it in right there in front of your face, and you can see the results right away.
The nice thing too with filler, what we do in our office is not only do we use the filler to fill the acne scars, Kelsey and I will also go in and subsize. Subsize means we're breaking up the fibrous bands. Because what an acne scar is, it's the collagen being pulled down by the scar tissue. So if you can imagine, if this is the skin, what Kelsey and I are doing when we inject the filler, we're breaking up the bands. So not only does the filler plump the skin, it also helps get rid of those bands, so your overall skin looks better. People will come back to us a year later after all their filler has dissolved, and their acne scars look still amazing because those septae, those fibrous bands, are broken down. So it's a cool option if you literally are getting married next week and you want your acne scars gone. Filler is the way to go.
Yeah. Yeah, and I would say little to no downtime. There's a chance you could get bruising in a few areas, but most people it's in areas that are not super prone to bruising, so it's a nice treatment.
There are a bunch of other little laser rejuvenation types of things we can do. Those are kind of more niche types of things, but these are kind of the main things we do for acne and for acne scarring. Beautiful. Anything else that's off the wall that you recommend, like apple cider vinegar, rubbing your shoe on it?
I can't think of anything I have off the wall. The one thing I always try to reassure patients though is I feel like anytime anybody gets scarring, it's either, moms are always trying to blame teenagers for causing the scarring. And some people will, blame themselves or quickly say like, I promise I don't pick at it.
Yes.
And it's just partly genetic. It's the way your skin is designed and made. People can have very mild acne and terrible scarring from it. So that is one thing I always try to reassure patients. Like, it's not necessarily your fault. And yes, there are things that you do that can worsen that, but I think that's one important thing, especially for the moms out there.
Another thing too, on totally the opposite note, is that if your child is starting to scar from acne, even if it is mild acne, bring them to see the dermatologist. We have special things, like this is why we went to school, to understand skin. It's much, much, much less expensive to treat acne than it is to treat acne scarring, so come in sooner. Awesome. We're going to move on to another scarring condition called dermatofibromas. A little photo of that. Dermatofibromas are these hard little scar tissue. They typically present as these round, hard little nodules, usually on the extremity, on the arms and legs, although they can be seen in the upper back and other kind of collagen areas. They typically arise from an ingrown hair or mosquito bite, and then they form these hard, round things. The problem that Kelsey and I see with dermatofibromas is that some people go to their doctor and it won't be identified correctly, and the doctor will remove it. And then that actually causes more scarring. Dermatofibromas should not be removed because they're already scar tissue growth, so they're already in their hyperactive phase. You should not cut them out because you'll get more scarring. Would you say, Kelsey?
Yeah, I would say that's a general rule. I will say I have cut some of them out.
Yes.
Particularly for women, if you're constantly shaving over the top of it. I had one the other day that was, sticking up pretty far off of the skin. And in those situations, I tell patients there's a real chance this could come back, but we'll try it and see what happens. And I think that's the main thing. They don't have to be treated. A lot of people live with these forever and have no idea they're there.
Right.
Other people notice them because they feel them, or cosmetically they notice
They get
them.
inflamed, yeah.
Yeah.
Yep.
But
they can be frozen. They can be cut out, but they have to be cut out appropriately, not too deeply, because that actually can make them look worse. So we always encourage non-invasive ways first, like freezing, maybe put some topical prescription steroid on it. So there are options. You don't have to live with them, but you can live with them.
Yeah.
There's a very rare malignancy that can develop in dermatofibromas called dermatofibroma sarcoma protuberans. They're kind of low-grade sarcomas, muscle cancer. So if you have a hard scar tissue growth that is starting to grow and bleed, you should see a dermatologist because they are, malignancies. Should we move on to keloids, Kelsey?
Yes.
So this is one of our favorites. This is a patient that Kelsey treated.
So keloids, again, tend to be mostly a genetic predisposition, and these, this poor patient, these keloids, or these scar tissues, are really hard. They can be very itchy and tender, and these showed up because of acne. So these started as very small little acne bumps, and the scar tissue ends up becoming much bigger than the acne itself ever was. And there's lots of different treatment options for them, but I always tell people it is, a lot of people, this is normal for them, especially in certain skin types. Like a lot of our lung population, African American,
dark skinned people, Indian people, Asian people, Caucasian people can get them too, but it's more prone in certain genetic types.
But I would say especially among, my black African American patients and my Hmong patients, a lot of times it's like, oh, there's nothing you can do. Everybody I know gets these.
Yes.
I shouldn't treat them. And I'm like, but is it itchy and tender? And they're like, well, yeah. So it is 100% worth treating if they're bothering you. I will tell that right off the bat. And there is a lot we can do for them. You can see the difference.
This is one we removed. This is the Hmong patient of ours.
Yeah. So this can be really, these ones typically aren't bothersome other than they're sticking out really far from the ear.
And this poor girl could wear her hair in a ponytail.
Yeah. So these ones, the ones on the ears, are as impressive as they are actually some of the easier ones to treat and get rid of. So if you're
this is one treatment, right? This is one. I mean, what else in life can you achieve that with one treatment?
Yeah. So this can be life changing.
Right?
Even we have patients that have one spot from a surgery that we did, or surgery somebody else did, and it will drive you nuts.
The
itching from them. So just know that there are treatment options for them. The most common thing we do are steroid injections. The steroid helps to break up the collagen that forms that thick scar tissue. And it significantly, after one treatment, will significantly improve the itching and the tenderness. It usually, for something like these chest scars, will require multiple treatments to really thin them out and get them to go away. And the important thing with a keloid too, like this one on the ear, they're easy to get rid of, they're easy to cut off. It's difficult to keep them from coming back if you're genetically predisposed to this. So there's lots of options for that too.
We do have a new thing for that, something called superficial radiotherapy, which uses soft X-ray, and it has the highest cure rate for removal of these keloids. So Kelsey and I have treated lots of people. We remove it, you come in daily for 3 days in a row, and it has an 85 to 95% cure rate. So there are some great things we can do these days for them.
Yep. And there are, that CO2 laser we talked about for the acne scarring can actually help with the keloid type of scars as well. And there's always, there's certain over-the-counter things that you can do, and even if it's a one spot, even doing manual massage can actually make a really big difference.
Hydration, manual with lotion, Vaseline, manual massage, that's a simple thing.
Yep.
Let's move on to superficial radiotherapy. This is an awesome thing that we're talking about with the keloids, but it is something that really is helping our patients not get scars from bad skin cancers. So this is a patient with a pretty large skin cancer on her hand. You can imagine if we would have cut that out, she would have had a large scar, and more importantly than how it looked would have been how it felt. That can get really uncomfortable there, because these skin cancers can sometimes go down to the tendons. So this skin cancer was treated successfully in mine and Kelsey's office with this superficial radiotherapy, where these soft X-ray beams, which are less than even you get through going through a airplane detector, slowly get rid of these skin cancer cells without any scarring. So this patient was thrilled. Your patient too, Kelsey, right?
Yes. So I think the scalp is probably one of my favorite areas.
This patient was 90-something years old, and she's like, I'm just gonna live with this. It hurts, it bleeds, but how am I gonna get it cut out?
Yeah, exactly. It's really scary when a lot of people, it is
upside down.
common. It is common for people to let things go, especially our older population.
Yes.
They're like, I'm gonna be dead next week anyway, and then they're not.
Yeah.
We hear that a lot, but we promise there are really, simple things that we will help you walk through if you do have something that, because they will bleed and hurt, and they're
This
quite
was just
dramatic.
kept growing for this poor lady. You can see, like, the picture doesn't do it justice. It was like this mound. She had a mountain, a volcano on top of her head. And now it's nice and flat, and she can just arrange her hair over it. Before, she had a mountain sticking out of her head, poor thing.
Yeah.
She didn't know that a non-surgical option existed because she really didn't want to go through the knife. I mean, unfortunately, people say to us, Kelsey knows people who are like, oh, I'm 80 years old, I'm just going to let this go. But sometimes you can die of skin cancer too, in all seriousness. Like, you've seen people in the nursing home who die of skin cancer. So,
it is worth coming to talk to us, and we'll talk through the options, and in the end, we'll find something that works for you and your lifestyle. But the SRT is proving to be very life-changing for a lot of people, even our young people who
don't want any scar at all.
It's been a really great treatment option for them too.
Right. We have a few photos on our website of people who are 40, 50 years old who had large skin cancers on their nose, and they maybe had surgery somewhere else, and they're like, I just don't want to go through surgery again. I just can't go through surgery again. And they've done superficial radiotherapy, and they literally have no scar, or, they have no visual reminder. And, you don't want to look in the mirror every day and be reminded that you've had a skin cancer.
Mm-hmm.
So, we'll finish up with Mohs surgery, which is another modality that we use for skin cancer. That's where we remove the tissue, take the smallest amount possible, and then check it under the microscope. So the nice thing about Mohs is if it's done properly, you take such a small amount of tissue and it can actually heal really nicely. So this was a pretty small skin cancer. This was what it looked like after the removal, and you can see it's this is 3 months out, barely visible. Now a year out, you can barely see it on this patient. So we see some pretty good things with Mohs, don't we, Kelsey?
Yes, and I always reassure patients, Mohs surgeons like Dr. Tareen go through a special fellowship where they spend a lot of time on the anatomy of the face and the way the tissues lie and everything like that, to try to minimize the scarring in the first place, but also to know how to hide the scar in your natural contours and put it in a way that it's not going to interfere with the way your eyelid closes and things like that. So it's a very particular type of surgery that only certain people are trained in, and it's important to find somebody that has that special training.
So yes, we have lots of tips and tricks on scars. So if you have any questions, just let us know. You can make an appointment. You can send us a message. Nicole, Christine, do you guys have any questions from the audience?
I have one. So they were just wondering how long the downtime is after CO2.
Kelsey.
I think this is highly dependent on the person. Part of it also depends on how bad your scarring is to start with. Because if it's really bad, we're going to be more aggressive in more areas. If it's a little bit more superficial, we don't have to go as deep with the laser, so you have a little less downtime. For sure, I think you need to plan social downtime of, I would say, a good 10 to 14 days for most people. After that, you may still have some effects from it, but it's going to be much easier to cover with makeup and you're going to feel normal. But you have to give yourself a good 2 weeks of not doing anything important.
I would agree with that.
Perfect.
When I get CO2, I usually just do it like on one little area, and if you just do one little area, the downtime is much less because your skin has less area to heal. So when I just do my cheeks, my downtime is 3 to 5 days. When I do the whole face, it's like 1 to 2 weeks. So
Perfect.
awesome. Thanks for tuning in to our Facebook Live on Scars.
Thank you.
Thank you.